There's a lot of chatter in the virtual space these days about microdosing GLP-1 medicines, like the GLP-1 receptor agonist semaglutide, which you probably know as Ozempic or Wegovy, and the dual GLP-1 GIP receptor agonist tirzepatide, which is Mounjaro or Zepbound. So what does microdosing mean exactly? Well, that can refer to taking a lower than approved dose of GLP-1 medicine. It can also mean taking a dose in between approved doses, especially in countries like Canada, where the GLP-1s are available in flexible dose pens with the click counting approach. What microdosing is not is taking GLP-1 medicines inappropriately. For example, a person who doesn't have excess body fat who wants to lose a few pounds to fit into a tight dress. Microdosing is off label, meaning that this approach doesn't follow the official guidance recommended in the product monographs. Product monographs can only recommend the dosing approach that we studied in clinical trials, and so far, no clinical trial has ever looked at the microdosing approach. While many people do really well with standard dose titration as per the product monographs for GLP-1 medicines, reasons to microdose can include increasing the dose more slowly to improve tolerability to side effects, which are usually gastrointestinal. It can be for people who don't need the maximum dose of medicine. For some people, the maximum dose could be too much. It can be to use the best dose that works for that person to achieve their health goals, and it can be used to stretch out prescriptions to save money for some people. Clinicians, including myself, commonly support and, in fact, recommend microdosing approaches. While not studied formally in clinical trials, anecdotally, some of the benefits we see are that people who don't tolerate the standard escalation dose can tolerate really well with slower dose increase. Some people don't need the full dose of medicine. Microdosing helps them precisely find the best dose to achieve their treatment goals. And practically speaking, some people can't afford the cost of the standard dosing, but they can afford it when they stretch it out by microdosing. So a note on that is that the GLP-1 medicine pens have a maximum time in use as studied and established by the manufacturers, and these times are exceeded with the microdosing approach. So it's important to be aware of that. It's also important to remember that GLP-1 medicines are not just for weight loss and diabetes, but are also proven to have other health benefits like reducing heart attack and stroke risk, MASH or fatty liver benefits, diabetes prevention, and improvements in sleep apnea, heart failure, and pain due to osteoarthritis. As we talk about in our Obesity Canada 2025 Pharmacotherapy Clinical Practice Guidelines, I'm the lead author of that guideline. We recommend that if a person is doing well as they work their way up on medication, that the dose should be progressed to the dose that has the proven benefit, provided that it continues to be well tolerated and is not causing too much weight loss. So the bottom line is that GLP-1 microdosing, which means using lower than the approved dose or using a dose in between approved doses, while this is off-label, it is a very practical approach that can be valuable for people who don't tolerate the standard dose titration, who don't need or don't tolerate the full dose of medication, or people who can't afford the full dose of medication. In the future of obesity medicine, I would really like to see clinical trials and subsequent guidance on product monographs that don't have specific rigid dosing or dosing goals, but rather with full flexibility to titrate medication as needed, as tolerated, and as appropriate for each individual to achieve treatment goals. And finally, important, as always, this blog is not intended as individual treatment advice. Discuss your individual treatment needs with your healthcare professional. I'm an investigator in clinical trials of semaglutide and tirzepatide. As a disclaimer, I receive honoraria as a continuing medical education speaker and consultant from the makers of semaglutide, Novo Nordisk, and tirzepatide, Eli Lilly.